So, till now, we have studied about the general osteology, about the development of the bone, how bone forms from the mesoderm, mesenchyme, cartilage, and the bone. There can be some alternate ways, like I had told you. We talked about the classification of the bone, classification of epiphysis. We talked about the classification of the joints and the further classification in its their category. Today, we will see the skeleton as a whole. We will see the spine. We will see the different parts of the spine and what are the specific names of it, the specific characteristics, and everything. So, suppose this is you. Just a minute. This is you, your head, neck, trunk, and your upper and lower limb. If we go to categorize it, we will categorize the skeleton into two parts. This part known as the axial skeleton, which is forming the axis of your body. And then we can form this another appendicular skeleton, which is forming the appendages. So, human skeleton is divided into two parts, axial skeleton and appendicular skeleton. See, appendage means limbs here. In the axial skeleton, I draw through this image. So it has head, neck, and trunk. So it will include your skull, spine, ribs, plus you will tell me what is the another one bone left here? Sternum. What about the appendicular skeleton? What bones you will have here?
upper
You will
extremities,
have,
lower extremities,
yes, you will have a bone of upper limb and lower limb. Upper limb will have pectoral girdle.
radius,
No, you will have to say pectoral girdle plus
pectoral
plus bones of brachium or the arms, bones of antebrachium or the bones of forearm, and the bones of hand or the bones of manus. In the lower limb, you will have pelvic girdle, you will have bones of thigh, bones of leg, and bones of foot, right? Now, in this axial skeleton, we have skull. Why do we need skull? Do you have any answer? Why do we need skull and spine?
to support the
If you
movement and protect internal organs.
see the basic function of the spine and the skull is, have you ever seen a brain? Have you seen brain? Brain has jelly-like consistency. If you have brain in the hand, it can easily wiggle. Like if you have seen Tom and Jerry, you must have seen the jellies. And तुम्हें याद होगा how it used to jiggle. So they are so much soft. And now if something is so much soft, you need some sort of protection. And that is why you have, for the protection of the brain, you have skull. I'm sorry for the diagram. And for this protection of the spinal cord, you have vertebrae.
vertebral.
Okay, so that's true. Skull is for the protection of brain. Spine is for the protection of spinal cord because they are very soft and delicate structure and they need protection. For example, your friend came to slap you and he accidentally hit at you on your, you know, brain. You would have died. But if you have protection from the skull, Even if he hits you with a baseball bat, you will still be okay, depending वो टेरियन एस्योरन पे hit ना कर दे. Now, this is done. What is the function of ribs and sternum? If I'm drawing this from sagittal plane or the sagittal section of the thorax, anteriorly you will see the sternum, three parts, manubrium, body, and the xiphoid or the xiphoid process. Posteriorly, you will have the vertebrae. What kind of vertebrae are they? If this is present in the thorax, they are thoracic vertebrae. I will tell you, don't worry. So you will see ribs. Have you seen a parrot? A parrot is present inside a cage so that it does not fly away and something, a cat or something, doesn't eat it. So that is for the protection. Similarly, in your thorax, you have this thoracic cage, and that is for the protection of the visceral organ and also to give the lung and another structure. Like that is for, like I will tell you about the intercostal muscle, they help in the breathing. So you had in the axial skeleton, skull, and the spine. I told you the function. You had ribs and the sternum, and the function of it was to form the thorax. Now, let's talk first about the skull. What is the another name of skull? Cranium. Okay. Now the cranium can be divided into two parts. Suppose if I draw this as your skull, guys, let me know if you need like this is these are very basic concepts. That's why I'm not using Atlas images. But if you need it, let me know. I will shift to the Atlas images rather than drawing the schemes. One part contains the brain. Just a minute. One part will contain the brain. So the part of skull which is containing the brain, this is known as neurocranium, while the rest of the part of the skull, which is containing your nasal cavity, your oral cavity, which has forming the boundary of the pharynx, those bones are the bones of viscerocranium. It means your skull is providing the protection not just to the brain but also to the visceral organs. For example, your eyes, they are present in the orbit. For example, your tongue, your glands. So you have neurocranium and you have viscerocranium. Viscerocranium is also known as facial bones. Okay, and neurocranium is also known as क्या कहते हैं?
Calvaria.
Cranial, no, calvaria. See, uh, I think I will have to take the image. Calvaria is the roof. Calvaria is just the covering. This is just the roof. Let's just take an image of skull station. Skull. See, I told you this entire part is the skull. Inside you will have the brain. So all the bones, frontal, parietal, occipital, this is your frontal bone, this is parietal bone, this is occipital bone. This is temporal bone. Then you have inside a bone known as sphenoid. Sphenoid is butterfly-shaped bone. I will tell you about the osteology of the skull in the head and neck, so don't worry. Frontal, parietal, occipital, sphenoid, ethmoid, and temporal. These bones are forming a box-like structure so that you can contain your brain here. Okay, so that you can have your brain. So this is your neurocranium. If you see inferiorly, you have your eyes in this part, you have your tongue in this part, you have different kind of ganglia in those part. So all this part that you see here, this is your viscerocranium. Okay, so bones of the cranium and the bones of the face, facial bones and cranial bones. Now, one of you just said the cranial calvaria. So what is calvaria? See, I divided skull into neurocranium, viscerocranium. Now, if this is a room and you have brain inside, it will have roof, it will have floor, and it will have walls, right? Now, if you have to sew it, what you will do is you will cut. If you have to sew the cranial cavity, you will cut it from this part. So, if you cut the skull this way, this entire part or the cap is known as calvaria. So, calvaria means the cap of the skull. Okay, and then you will have the base of the skull. This will be pure base of skull. So, calvaria and floor. Is this clear?
Yes.
Now, we talked about the skull bones. One more thing you have to remember is that here there will be a small bone known as hyoid, os hyoidum. Hyoid is a very strange bone which will look somewhat like this. It has two horns, lesser and greater horns, originating from the that is second and third pharyngeal arc. I will tell you. If I show you the actual image, hyoid, this is the only bone of the entire body which does not articulate with any another bone. Usually you have seen like, if this is your humerus, your radius will attach to it, your ulna will attach to it. But hyoid is a only bone in your entire body which will not articulate with any another bone. It just stays there with the help of certain membranes and the certain muscles. For example, let me show you neck muscles. Here you can see this bone is your hyoid bone and various muscles will be attached to it. For example, you will have geniohyoid muscle. Geniohyoid will come from genial tubercle to the hyoid. Then you will have hyoglossus. Then you will have multiple muscles. For example, this muscle that you see here, on the inner surface of this mandible, this is your mandible or the lower jaw, you will have a line known as hyoid line. So a muscle will come from there attached to the hyoid known as mylohyoid muscle. Okay. Similarly, you will have a muscle not shown here because this is present deep to this muscle. This will come from the genial tubercle to the hyoid. The name will be geniohyoid. So what I'm telling you is that this bone, hyoid, will not articulate with any of the bones of the entire body, not just the head or neck. It will not articulate with the any bone. It just stays there with the help of another muscles. For example, you see large number of muscles are attached here. This one, this one, this one. this, this one, this one. You have digastric muscle, you have this stylohyoid muscle, you have mylohyoid, you have geniohyoid, you have thylohyoid, you have sternohyoid. Lots of muscle will be there. So just a thing to remember. I will tell you about it in the head and neck. You see, I am multiple times I'm referring head and neck में पढ़ाऊंगा because right now I will teach you about the thorax so that I can teach you splanchnology and cardiovascular. And teaching you about, directly the splanchno will not be good thing, will not be a good idea. That's why I'm teaching you osteology. So in today's class, we will see the spine in its full glory. Up तक this was a very basic thing. Did you got this? Guys,
Yes, sir.
itna okay. So besides this, now we have to complete our like do you know about the sutures? In the last class, I had told you about the sutures. Do you remember it? Sutures, the
Yes.
bones of the joints of the skulls. And sutures are very exclusive to the skull itself. Now, coming to this classification you won't see in the Russian books, but if you say this to your teacher, they will be more than happy to give you good marks. So we discussed about the skull. Now is the time for the spine. What is spine? Any one of you?
Uh, Spine is the bone structure that covers the vertebral column. Spine.
Sorry dear, your voice is not so clear. Do you see this? Hello.
Yes.
Do you see this image? The spines of the plant? See,
Yes.
the spine, or you can say the term vertebrae, has come from a Latin word known as spine, and it means the spines of the plants. They are very erect and they are structurally very stiff. So you have, suppose you have body like you have neck, you have just head, you have your ribs and everything. You need some, rigid structure to hold everything. टेक दिस पार्ट एज अ स्टोरी आई विल ऑलवेज टेल यू कुछ पार्ट जो होगी तुम्हारी एकेडमिक पार्ट होगी कुछ पार्ट होगी दैट वुड बी विजडम पार्ट सो दिस इज द विजडम पार्ट डू यू नो अबाउट द स्पाइन ऑफ scapula let me just draw the scapula itself suppose this is your scapula and you know the scapula also has spine so what the spine itself means
To
do
support
you know yes this is a it means a structurally supportive structure providing the strength to body. What are the features of the spine? See, if you would not have spine, तुम्हारी body नीचे गिर जाती. You wouldn't be able to stand. So, like when we build homes, we build pillars to give it structural support. Similarly, in the body, you have spine. For example, your scapula. Why am I telling you about the scapula? Because when you see the scapula in its transverse section, and not transverse section, if you cut it from this way in the coronal plane, you will see the scapula is very thin. So much thin that you can see light across it. So if something is very thin, isn't it a good idea to give it a rod-like structure or a supporting structure? That is why in the scapula also, the supporting structure is known as spine of scapula. So spine is nothing but a supporting structure. In case of male, that will be around 71 centimeter long. In case of female, that will be around 61 centimeter long because the height of the average male and female is different. What else? Okay, tell me one thing. Why do we say spine as vertebral column? Why do we say it? So
Because
suppose
it
you have a
consists
class.
of many bones.
Yes, Manny. Suppose this is a classroom and this is a blackboard, and there are many tables in this classroom. Okay. If you see this all like this one, horizontal grouping is known as row, but this vertical grouping is known as column, right? For example, this is column A, this is column B, and this is column C. Similarly, in the spine, you have something known as vertebral columns. And if you arrange many of the vertebral columns one over another, I'm sorry, guys. If you arrange so many of the vertebral columns one over another, can we say it vertebral column? Suppose these are the stacks of coin. So can you say it coin column? Similarly, if this is a stack of vertebrae, can you say it as vertebral column? See, I'm taking you from the very basics, because it will take me just, 15% extra time, or maybe not just 15%, maybe 20% extra time, but each and everything will be clear for you. Like this is very basic, but बाकी चीजों के लिए ना बाकी topics के लिए this will be very good for you. Let's save this to the photograph. So I told you your body has these vertebrae. Vertebrae are the bones of the spine, which are present in a column. That is why they are known as vertebral column. Your vertebral column, suppose this is your body, just this spine or the vertebral column forms 2/5 of height. Your legs are very long. So it forms 2/5 of the height. For example, if you are 5 feet long, your spine will be foot. Okay? इतना clear है?
Yes.
Now tell me one thing. Why do you have spine itself? Why do we have
To
spine?
protect the spinal cord,
Okay.
and provide support to the body.
Yes. But what kind of support?
Support to the
Axial
organs in
support.
abdomen.
Yes. So see, first of all, let's draw our spinal cord, our spine. So can you see that your head is resting over the vertebrae, the spine? So first function is your skull will rest over it. Second, it provides attachment to upper limb. For see here, it will provide the attachment to the upper limb with the help of muscles. Third, protection of spinal cord. Fourth, attachment of ribs, right? So it will support the head, it will serve as the point of attachment for the ribs, the pelvic girdle, and your pectoral girdle. इतना समझ में आया? What is the function of spine?
Yes.
Now, if you see a spine, suppose this is your spine. This is the body. I will tell you about the centrum, neural arc, and everything. On this part, you have a structure about which I already told you, known as intervertebral disc. Example of secondary cartilaginous joint. Okay. This is here present between two adjacent vertebrae. What is the function? Before understanding the function, see, can you see the surface is very rough? So the rough face is provided here so that your intervertebral disc can attach here in a good way. Intervertebral disc is here so that you can resist the compression. This will be very, like cushion like. So it will provide the cushioning, it will provide the protection, and it will provide movement. What kind of movement? If this is moving anteriorly, flexion. If this is moving posteriorly, extension. If this is moving laterally, this is known as lateral flexion. Okay. And if you move sideways, that is known as rotation. Okay. Got this?
Yes.
Now tell me one thing. How many vertebrae do we have? Well, that depends upon age. For example, in a newborn, you have 33 vertebrae. You have vertebrae of the neck, known as cervical vertebrae, vertebrae of the thorax, thoracic vertebrae, vertebrae of the abdomen, or lumbar vertebrae, vertebrae of the pelvis, known as sacrum plus
Okay.
coccygeal. मैंने ये क्यों लिख दिया ऐसे? Pelvis, sacrum plus coccygeal. Okay. Now see, this is for a newborn. Even in the childhood, soon क्या होगा ना? Like, for example, you have this sacrum. I'm just drawing the image. Now I will tell you. See, how many cervical vertebrae you have? If you are a human being, if you are a ghost, if you are a giraffe, or you are a buffalo. All the mammals have
7.
7 cervical
Seven.
vertebrae. Yes, you're right. 7 cervical vertebrae. In the thorax, you have 12
12.
thoracic vertebrae. And
Five.
yes, lumbar will be 5, sacrum will be 5,
Five.
or coccyx, it can be between 3 to 5. Okay. Now see, these vertebrae, the cervical vertebrae, thoracic vertebrae, the lumbar vertebrae, these are unfused. Okay. Now I will remove this. They are unfused. But with the age, for example, as you enter in the teenage, the sacrum starts to fuse. For example, here you had this cartilage. Now it will start to ossify. This cartilage will start to ossify. And the 5 vertebrae that you had here, the sacral vertebrae, this will form the sacrum. Remember this, L and Similarly, you had coccygeal vertebrae. They will fuse to form coccyx. That is why you must have read about coccygeal vertebrae and coccyx also. So, इतना समझ में आया?
Yes.
So you had
Sir,
unfused and
difference
you had.
between coccygeal and coccygeal.
See, coccygeal is when they are unfused. For example, you had 1, 2, 3, 4, and 5. They are unfused. Those are known as coccygeal vertebrae. But when they are fused, now they are known as coccyx. Okay, समझ में आया?
Yes.
Yes, sir.
Just read this. Fused form of sacral vertebrae is known as sacrum. Fused form of coccygeal vertebrae is known as coccyx. Got it? Now tell me one thing. Initially we had 33 vertebrae. Now since we have 7, 12, 5, these are fused, so these are 1 and 1. So how many vertebrae do we have? 12, 7, 19, 20, 25, and 26. That is why I told you the number of vertebrae will depend whom you are asking, whether you are asking a child or whether you are asking a grown adult. So that can range from 33 to 26, depending upon age. Got this? समझ में आया इतना?
Yes.
Now, when you are born as a child, अरे ये कर्व्स नहीं. In a few last class, I was very, very tired, so I'm really sorry. If you had any doubt from any of the previous class, let me know. Back then, I was just sleeping 2.5 hours. So, अगर किसी को उसमें कुछ भी नहीं समझ में आया हो, because I felt, see, it's not about you. Like मुझे भी ऐसा feel होता है whether I did deliver so much or even enough or not. So I did not feel, especially for the last class, that I was in my full energy. So if you have any doubt, just just text me. I will reply to all of your answers. Now see, when you are born as a child, you have a single curvature here. But when you are an adult, you have these many curvature. Do you know the reason why?
No.
Suppose you are a toddler right now. You are just, crawling onto the floor. What can you do at the most? Like, not like toddler की भी नहीं बात करते हैं. You are just a child in a crib. You can just lift your head, right? You can just lift your head. With the tensions created by the muscles, you will form this curvature. You will form this curvature here. Like these are the muscles acting onto the cervical vertebrae, and the curvature will shift from a primary concave to now concavo convex. Can you see in the cervical region you have this curvature? See, in this very good diagram, when you are born as a child, this is your spine. You started lifting your head, and because of the muscles tension, this became your curvature, right? Hello, is
Yes.
that right? Now tell me one thing. If you lifted the muscles of the neck, you got the cervical curvature. What if you are doing the movement at your hip joint? क्या होगा? On the hip joint, you have psoas major, psoas minor muscles. Besides, psoas major and minor muscles are attached with the transverse process of the lumbar vertebrae, iliac fossa, and you had, the subcostal ridge of the 12th rib attached with the iliac crest, your quadratus muscle. So, itna nahi yaad rakhna, I'm just telling you, those muscles will act onto your lumbar vertebrae, right? So, now you will develop one more curve, right? This was your cervical curve. This was your now lumbar curve. Now this is just the story part. Now see, तुम्हें ये चीज कैसे समझ में आता है? The curve that you are born with are known as primary curvature. The curve that you make after the birth, these are known as secondary curvature. Primary curvature has another name जिसका नाम है kyphosis, and the secondary curvature has a name lordosis. So come to this picture. You have a single curve. This is primary curvature. I'm sorry. Now I told you when a child starts to raise his head, he forms this secondary curvature. पहले देखो ये concave था. Now this is convex. So this is secondary curvature and the curvature of cervical region. So cervical, and what did I tell you? What did I told you? What is the another name of secondary curvature? Lordosis. So you have cervical lordosis. Now see, you cannot move your thorax. Like you cannot move the spine of the thorax. So this curvature will remain in a concave manner, right? So this will be a primary curve. And what do we call the primary curve as? We call primary curve as kyphosis. So this is thoracic kyphosis, and this is a primary curve. Then I told you when a child will start running or maybe walking, and he will develop one curve, and the curve will be the curve at the level of lumbar vertebrae. Here, this one will develop. Let's see here in this image, right? This is a secondary curvature. And secondary curvature को हम क्या कहते हैं? Lordosis. So this will be your lumbar lordosis. If someone did not understand, maybe you have this confusion what is concave and what is convex. This has a cave like structure. गड्ढा है इसमें, गुफा की तरह है. That is why known as concave. But if you are watching it from this side, यहाँ पे तो गड्ढा नहीं है ना. This is elevation kind of thing. So this is convex. See, cave याद रखना, तुम्हें ये याद हो जाएगा. So what did I tell you? I told you with the birth of the child, he was not moving any muscles. So since there was no movement of the muscles, you have just single curve. This curve is known as primary curvature.
Primary.
And the primary curvature का नाम क्या होता है? Kyphosis. Now, as the child starts to raise his neck, like he will raise his neck. Have you seen a child? Like when you come to his room, he will just lift up his head and he will start smirking at you. So that is a curvature of the cervical region. You can see here. This is the cervical vertebrae. So the curvature will be cervical, and हम secondary curvature को क्या कहते हैं? Lordosis. So cervical lordosis. And since this curvature has formed after the birth, this is secondary curvature. Similarly, at the level of the lumbar vertebrae, when a child starts to walk, he will form another curve, the curve of the lumbar region. And what is the name of the secondary curvature again? Tell me. What is the name of secondary curvature? I just told you, lordosis. हाँ
Lordosis.
यार
Okay.
प्रॉब्लम हो रहा है क्या? सी प्राइमरी कर्वेचर किसे कहते हैं? प्रेजेंट फ्रॉम बर्थ. व्हाट इज द नेम? kyphosis. What is secondary curvature? Formed after birth. What is the name? Lordosis. So at the cervical region, you when the child raises his head, you have secondary curvature development, and since this is cervical region, cervical lordosis. In the lumbar region, secondary curvature is formed, so lumbar lordosis. And since the child does cannot, move his, thorax in a very different manner, like thorax को तो lift नहीं कर सकते हो ना, but you can lift your head. So this will remain as a primary curvature. And what is the name of primary curvature? Tell me. Everything is written there.
Lordosis.
Kyphosis.
Yes, kyphosis. So this will be what kyphosis will it be? If this is the thoracic region, the curvature, the kyphosis will be thoracic kyphosis, right? समझ में आया? Hello, guys, answer me.
Yes, sir. Yes, sir.
Now, have you ever read about scoliosis? This is an abnormality. Usually, the spine was supposed to curve antero-posteriorly, but if the curvature is laterally, like a snake, this is known as scoliosis, and it requires surgical intervention. समझ में आया?
Yes.
One more thing is that the development of the curvature of the spine is very important, because suppose this curvature was like this. Have you seen a human with humpback? You
Yes.
must have seen
Yes,
it
sir.
once in a life. That is because of a
Uh,
very prominent thoracic thoracic
Lordosis.
thoracic में lordosis कहाँ से होगा? वो primary
Guys.
curvature है. That would be
Sorry.
kyphosis. So याद रखना ये चीज को, don't worry. ऐसा होता है. This is a new terminology for you maybe. इतना समझ में आया?
Yes.
समझ में आ रहा है ना? ऐसा कुछ तो नहीं है ना कि लाइक मैं कुछ कह रहा हूँ और वो तुम्हारे सर के ऊपर से जा रहा हूँ.
नहीं नहीं.
आ रहा सर, आ रहा
Guys, हाँ,
Yes. Got it.
okay. Now let's see our best friend vertebrae. Guys, if you ever need to study anatomy of the bones, I will suggest you to study it from the Atlas, Times Atlas. If you have, like, if you are a rookie right now or a beginner, but if you are now a legend, just go to this website, Anatomy Standard. This is my favorite website for studying the anatomy of the bones. You will never find a so much detailed image anywhere on the internet. Like Canhub's Atlas is my favorite for everything, but for osteology, this one is the best. Let's open our spine itself. Like, what should I tell you right now? Teach you. Let's take our thoracic vertebrae so that I can tell you about the vertebrae itself. I will save this image. First of all, see the structure. I will show you it again. अगर मैं भूल जाऊँ, remind me because once I will tell you about all the structure, it will be very good for you to see it in the 3D. I'll just take a screenshot. Yes. So let's see. I will keep it minimized for you here so that you can see vertebrae. Or this image. Where did I download it, those images? Ah, just a minute, guys. I'll just play this video again. Is it playing? No. So let's open the image. Before I tell you about the structures of the vertebrae in its detail, let's first see the classification. And like, not the classification of the vertebrae we have already studied, but about the parts. So see, if this is your vertebrae, it will have two parts, centrum or body plus neural arc with processes. What does I mean? What do I mean with this? See, this part that you see here, this is known as the body or the centrum of the vertebrae. You can see in this uh, video, like वो कैसा 3D में दिख रहा है. This is your centrum, and the part that you see here, a circular arc-like structure. This is known as neural arc. Can you tell me why this is known as neural arc? Because
Spinal
spinal
cord
cord is
pass through it.
yes, spinal cord is present in this part or it passes from this part, and spinal cord is a part of nervous system. So an arc which surrounds it, this is known as neural arc, right? Now in this neural arc, it has two parts. The proximal part is known as pedicel. This is known as pedicel, while the distal part is known as lamina. Now this is a very interesting part. Just see. I will highlight the centrum. Centrum, or what is another name of centrum here? Corpus or the body.
Body.
Yes. See the website that I just showed you, that would be very good for your exam of anatomy because it shows all the names in its Latin form. For example, you can see pedunculus arcus vertebrae. It means the peduncle or the pedicel of the arc of the vertebrae. For example, corpus vertebrae, the body of the vertebrae. So that will help in the exam also. So this was your body, this is your pedicel, and this is your lamina. And this entire part is known as what? Neural arc. Why am I telling you this? Because between the lamina and the pedicel, you have a process, and this process is known as
Transverse
transverse
process.
process. Now see this illustration. Present laterally. That is your transverse process here. Now, that was present between lamina and the pedicel. But between two lamina, you have this process known as spinous process. Now, do you understand why do we have different parts of the neural arc? Like we could have easily seen it like this is just the neural arc. Why do we need to give it like pedicel and lamina? Because between two lamina we have spinous process and between lamina and the pedicel we have transverse process. इतना समझ में आया?
Yes.
This was superior view of our spinal, not the spinal, our vertebrae. Now this is a lateral view. Here you can see this is your body. Don't ask me about these facets here because I haven't discussed, the details about all the thoracic, the cervical, and all the vertebrae. However, this is the costal facet for your costa or the ribs. I told you this is your transverse process present laterally, and you have spinous process here. जो भी मैंने पढ़ा दिया, I will highlight from the brown color. Whatever I have already told you, I will highlight it from the brown color so that you already know. Then I also told you about this pedicel. We cannot see the lamina because lamina was between the transverse process and the spinous process. Do you see something here and here? Just try to look at those structure in this visualization that you see here. दिख रहा है ये?
Yes.
I will use another image to make your life easy. Just see this. These and these I'm talking about. In this image, can you see those structures? Yes or no? Can you differentiate कि वो structures कहाँ पे present है? Can you localize them? If you see that in the detail, the process of one vertebrae is going to the process of another vertebrae. For what? For the formation of joint. And what do we say joint as? Articulation. So these are what? These are processes for articulations known as articular processes. Now, since this is present superiorly, the process will be named as superior articular process. And since this process is present inferiorly, this will be known as inferior articular process. Now, I have told you about the basic structures. Now, you have to visualize it. Right now, we can see the body, the transverse process. This is the spinous process. Now, suppose this is ear-like structure, जो कि तुम्हें ऊपर दिख रहा है. That is what? That is your superior articular process. The part that you see somewhat like this going down right now, that is your inferior articular process. समझ में आया?
Yes.
ऐसा तो नहीं है ना कि मैं एक टॉपिक पे बहुत ज्यादा टाइम ले रहा हूँ या फिर मैं कुछ ऐसा बिकॉज आई वॉन्ट यू टू नो एवरीथिंग बिकॉज अगर तुम किसी चीज को समझ जाओगे ना
Nice.
इफ यू अंडरस्टैंड बिकॉज इफ यू अंडरस्टैंड एनीथिंग you will just need a revision once in a 6 months. And to be like honest, when I was in my second year, I thought like I will give the exam in my October. So I stopped studying anatomy for first and second, for second and third semester because we had neurology and I really had the interest in that. So I only studied neuroanatomy. And I thought अगर मैं exam दे सकता हूँ मैं बाद में दूंगा. But later Olga Kamzinona, who was my teacher, she told me, no, Rishabh, give examination now. I had 3 days for 3 semester. I had to revise that much. Just think. And still I managed to got 5 plus from her in the examination with a proper 5 to 5 plus in every big control having a rating of 5. That too from Olga Khamsinovna. Because, like, if like, there is a simple quote: plead on training to win in war. It shouldn't be like you should win in the training and you should bleed in the war. Like, मजे वॉर में हो तुम्हारे, उसके लिए तुम्हें अभी बहना पड़ेगा. खैर, बहुत ज्यादा हो गया. Now, do you know about the specific properties of all the vertebrae of the different reason? Like someone has bifid spinous process, someone has something else. Do you about know about this properties? Anyways, I will tell you. So first of all, uh, one more thing I wanna tell you is that this was our what? This part was, what is the name of this part? क्या कहते हैं इसे? Vertebral foramen कहते हैं. See, if there is a foramen which is present inside a vertebrae, this will be vertebral foramen. And if there is a foramen present between two vertebrae, this is a foramen present between two vertebrae, that would be intervertebral foramen. For example, inter-university championship between two university, intra-university championship between in the university itself. So this foramen which is present inside the vertebrae itself, that is your vertebral foramen. And when you stack, suppose, large number of the vertebrae, for example, just a second in this image, you see vertebral foramen, vertebral foramen, vertebral foramen, you form a canal-like structure known as spinal canal or the neural canal. Why? Because your spinal cord is present inside. And why do you have this intervertebral foramen? So that nerves can come out of, so that nerves can come out. समझ में आया? Inside you have spinal cord, and since the spine nerves has to come out, they will come out of what? Intervertebral foramen. And since the spinal cord needs protection, that will be present inside vertebral foramen. इतना समझ में आया?
Yes.
यार बोला
Yes,
करो कई टाइम तो ऐसा मुझे लगता है ना कि like I left the meeting.
No. Everyone is here.
Okay, only 3 of you
yeah.
here. I
No,
don't know why. Okay, Tiwari, Utsav, you are from Jatun, right?
Yes.
Okay, समझ आ रहा है तुम्हें सब कुछ?
Hmm.
Okay. Now let's go to the next topic where we will see, like specific peculiarities. I will make a box for you. One, you will have cervical vertebrae, another for thoracic vertebrae, another for the lumbar vertebrae. Cervical, thoracic, lumbar. Centrum shape, the shape of vertebral foramen, and about the spinous processes. If you see, I will open it in the split screen. Let's open our cervical vertebrae, typical cervical vertebrae. If you see the body, does it resemble a U shape? Yes or no? Let me show you C7. That would be more prominent for you. देखो ऐसा expect मत करना like you will exactly see maybe U shape or something. You will not see anything like that in the entire anatomy except for a few places. Let's see our typical vertebrae. So the body is U-shaped in the cervical region, but if this is your thoracic region, the shape of the body will be, does it resemble heart?
Yes.
Yes, sir.
Your body resembles the shape of heart. So heart shaped. Let's see our lumbar vertebrae, typical lumbar vertebrae. Does it resemble kidney shape?
Kidney.
Kidney shape resemble कर रहा है ये? Does it resemble
Yes,
the
sir.
kidney
Yes.
shape? So that would be piriform or kidney shaped. Now come to the vertebral foramen. Let's see the shape of the vertebral foramen. What is the shape of vertebral foramen here? Is it triangular? This foramen that you see here, the vertebral foramen, what is the shape here? Is it triangular or not? I want an answer, yes or no.
Triangular oval.
This is triangular. Oval is found in cervical region. Let's see the cervical vertebrae, typical cervical vertebrae. Now here you have oval shape. I again am telling you, it is not entirely like
Yes.
not specifically. देखो यार, you can say this as triangular, this as oval, but if I say about the the subscriptions, for example, this part when I studied it, this was from med school boot camp. This is an international subscription for the US from the US. So मैं उसके basis पे बता रहा हूँ. This can vary slightly, and all the books vary slightly, so it would be better अगर एग्जाम के लिए पढ़ रहे हो ना, सैप में एक बार पढ़ के जाना. Not for the concept, but for the language और कुछ variations के लिए. However, मैं एग्जाम के स्टूडेंट को जब पढ़ाता हूँ ना, तो मैं उन्हें उस टाइप से अकॉर्डिंगली बताता हूँ. For the PDF, for example, I gave you that has every references from the sapping. Now, let's see our thoracic vertebrae. Now, this might again seem to you like this is also heart shape, but that is small, round. You cannot say everything is heart shaped here. हम sorry, ये सही है, small round ही है. मैं body देख रहा था, small round. So see, in the centrum, in the cervical region that was U-shaped, in the thorax heart-shaped, in the lumbar kidney-shaped. Why is this kidney-shaped? Can anyone tell me? Because lumbar vertebrae has very large pressure above it, so it expands. I will tell you about in the regional anatomy of the lumbar vertebrae, and I will discuss about it probably in the lumbar when I will tell you about the lumbar region. So मैं vertebrae level के हिसाब से discuss करूंगा. Now you have this spinous processes. Let's open the cervical vertebrae, typical cervical vertebrae in the lateral view. Typical. Let's see the spine itself. Just a minute, guys. C1, C7 complex. Now, can you see the articular processes are one over another? क्या दिख रहा है तुम्हें यहाँ पे?
Yes.
One is facing another. So, if we talk about the this articular process, then that would be facing up and down. If I talk about the thoracic vertebrae, typical thoracic vertebrae, Then articular facet, for example, superior articular facet is facing outside while the inferior is facing inside. है ना?
Yes.
If I show you about the lumbar vertebrae, then that is, see, superior articular process, it faces inside. It faces medially, to be specific, medially. Like, let me show you this L1, L5 complex. In this image, like I saw it, so let me just show you it from this way. Just a minute. See, this is superior articular process, this is inferior, and that is the spinous process, right? I will use the green color for superior and sky blue color for the inferior. See, this is your superior articular facet. This is facing toward the axis, right? While the inferior articular facet, this is facing away from the axis. ऐसा है या नहीं है?
Away from the axis.
Yes. Now let's see about our ये spinous process नहीं था, articular process था. Now let's see about our spinous process. In the cervical region, let's open cervical vertebrae C1, C7 complex. Let me show you the typical first. Can you see that the spinous process is like the shape of the tongue of a snake?
Yes.
So this is bifid, except C1 and C7, because C1 does not have spinous process, it does not have body, it only has transverse process. Remember it. I will tell you uh, about it specifically जब मैं वो बताऊंगा. If we go to the thoracic vertebrae, typical thoracic vertebrae, can you see that it is inferiorly directed? ये नीचे की side आ रहा है. So yes, the spinous process is long, inferiorly directed. This is very long. That's why I have mentioned the long. If we go to the lumbar vertebrae, then that is short and horizont, short, horizontally directed and is blunt. इतना समझ में आया?
Yes.
See, about this part, the osteology, since I had studied that in my first year, I don't have the notes in its digital form. However, I have those in the form of hard copy form में है वो. So what I will do is I will make the PDF and I will send the PDF of those pages. हालांकि in my first year I didn't knew like मुझे कहाँ से पढ़ना है नहीं पढ़ना है. So they will not all be like concise. Like one PDF is from the Canhub. I used to study osteology from the Canhub. That was very detailed. So don't worry for that. मैं हर एक चीज बताऊंगा. One PDF will be from that. Another will be from a page of a diary that will mention all these peculiarities. So is that fine with you?
Yes.
See, of course we did take lots of time, but देखो भी तो like बच्चों को ना ऐसे पता नहीं चलता यार what is pedicel, what is lamina, but we understood it so much beautiful in this, like with all those highlights and everything. I'm really sorry for the previous classes. It was really good today because I was feeling very energetic. I came from the class, I slept, so that. Do you have any question for today class?
We'll read PDF, then after that.
Yeah, let me know. What about you, मानसी? कैसी चल रही है पढ़ाई तुम्हारी? Do you have any question?
नहीं भैया।
Okay, if you have any, anyone who's watching this session also, any recording, you can always text me. Don't call me at the nights. It would be better not to call me from the 10 because I have classes. So you can call me in unofficial time, of course, after maybe 5 or 6, you can call me. But university times may do text me because I won't be able to take your classes during the classes. And about any issues about the technical stuff, please call or text to Pranav. He's our senior. He will take care of it. मेरा काम सिर्फ पढ़ाने का है. So if you are facing anything with the notes or any issue, please text him. And if you need any kind of academic help or anything, just text me to call me. With this, we will wrap up this session. I hope you guys liked everything. Goodbye. Take care. We'll meet on the Saturdays. Have a great day. Good night.